and so is the name Captain Daniel Moreland, the master of the sailing training ship Picton Castle, which makes its home in Lunenburg. He was recently awarded the Tall Ship America's highest honor, the Lifetime Achievement Award. The Lifetime Achievement Award is given to an individual who has dedicated his or her life's work to getting people out to sea and to work to preserve the traditions and skills of sail training. In the last 20 years of captaining the Picton Castle, Captain Moreland has circumnavigated the globe an impressive 6 times. Mr. Speaker, I ask that all members join me in congratulating Captain Moreland for his long and distinguished sailing career and for receiving the Tall Ships America's highest honor, the Lifetime Achievement Award. Thank you, Mr. Speaker.
Order, please. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is to the Premier. Mr. Speaker, there is another case this week of someone suffering from mental illness, including, in this case, thoughts of suicide, being turned away from our emergency rooms. This is the same story that we are hearing in community after community across the province. Mr. Speaker, we know our health professionals are doing their best, but the system is overwhelmed. This has become the health care crisis of our time, mental health services for people when they really need it. I'd like to ask the Premier, why are mentally ill people being turned away from our emergency rooms?
The Honourable Premier.
Mr. Speaker, I can't speak specific to the case the honourable member is referring to. I don't believe it would be appropriate for any Nova Scotian seeking medical support to be turned away from any emergency room in this province, Mr. Speaker. But healthcare providers make a diagnosis or decision on what is the next step. So I don't know what the interaction was between the doctor and that Nova Scotia, but obviously, you know, as we go across this province, we're working on community-based mental health intervention, as well as ensuring that every emergency room across the province has access to psychiatric care to be available. But, Mr. Speaker, that at the end of the day, somebody in that healthcare facility would make that decision interacting with that patient. It would be inappropriate for me to pass judgment on that interaction.
The Honourable Leader of the Official Opposition on his first supplementary.
Mr. Speaker, I truly wish we were only talking about one interaction. Mr. Speaker, the case this week is not an isolated one. We all saw what happened to Cody Glode of Millbrook, who actually did exactly what he was told to do when he went to an emergency room, Mr. Speaker, after having called the mental health crisis line. We know the case of Christopher Bagnall in Cape Breton, who went to the emergency room there, Mr. Speaker. Now there's another case here in Halifax. Mr. Speaker, in the case in Halifax, a friend of the mentally ill person, Mr. Speaker, said, when someone asks for help, we should give it. We should take them seriously. Well, I'm sure everyone agrees with that in this chamber, Mr. Speaker, and across the province. I'd like to ask the Premier, what is the point of mental health services if they are sending people away?
The Honourable Premier.
Mr. Speaker, again, Mr. Speaker, I agree with the honourable member. Everyone requiring health care services in this province should be receiving it. Mr. Speaker, I can't speak specifically to the case he's referring to. Obviously, the health care provider interacting with that patient would have made a determination. Mr. Speaker, it's one of the things, as all of our families have experienced some level of mental health illness, we all reach out looking for that health care provider. It's why we've worked extremely hard at ensuring that we invest in Schools Plus so that we can identify early on mental health challenges, that we can begin to deal with them in young Nova Scotians earlier. That's why we're investing in community-based supports, so that those families and citizens who require mental health services in our community today can have them close to where they live. But it is concerning when you hear of someone going to an emergency room and having some of the results that the honourable member referred to. But the healthcare provider has an interaction, Mr. Speaker, and it would be inappropriate for me to be judging that healthcare provider on the decisions that they made.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, when people have thoughts of suicide in this province, they are advised to call the crisis line, to go to their family doctor, or in a real crisis to go to the emergency room. They haven't seen a healthcare provider at that point. They're actually seeking that help. I truly believe everyone in this House wants that person to get the help that they need. No one questions that. But, Mr. Speaker, it is not happening. We're bringing example after example here to this House. There's no need to question our health providers. When they're there to provide that help, someone can be saved. In some cases, a life can be saved, Mr. Speaker. So will the Premier now admit or agree with us there is a crisis in the delivery of mental health, particularly when it reaches the point of suicide, and call a public inquiry so we can marshal the resources and identify what's needed to close these gaps so people get the crisis help that they need?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable for the question. The Minister of Health for the last 2.5 years has been working diligently with clinicians across this province to ensure that they transform the mental health delivery service, to working with the expertise that is being provided to his department, working and talking about community-based investment, that we're working to ensure that families get the supports they need as close to home. Very proud of the work that the School Plus program is doing. Dr. Stan Kuchar has been working extremely hard, ensuring that we begin to identify early on in our children if there are mental health issues, that we can address them early on. And we're going to continue to work with our healthcare providers. We're going to rely on their expertise, Mr. Speaker, to make sure that we follow the best protocols in dealing with mental health issues across this province, and that we're there for families when they need them. There is no question, Mr. Speaker, when a family is in crisis, we need to have a robust system that can be able to respond to that individual and support that family. And it pains everyone in this House when we hear of some of the stories that have been hearing, but we as a government are relying on the healthcare professionals who are asking us to put in place the right protocols and procedures to help them deal with those patients.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, since it took office, this government's plan has been to delay incurring any cost associated with replacing the VG. The initial work undertaken by the NDP government has been stalled for 2.5 years, while the government has been amalgamating the health authorities and picking fights with healthcare workers. Now, last year, when the Centennial and the VG buildings were with them both in disrepair, this government actually underspent its hospital infrastructure budget by $27 million. So my question is, why has the Premier put his austerity agenda ahead of the need to get going on replacing the VG?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. One of the first decisions that we made, Mr. Speaker, coming to government was the investment we're making in the Dartmouth General Hospital, where we're remodeling the 3rd and 4th floor, which we're removing about 50 beds. Out of the VG in the Dartmouth, where there will be 4 additional ORs that will be removed. Out of the VG to the Dartmouth site, that will require 8. The 5th floor will be renovated, Mr. Speaker, to provide services to those Nova Scotians. I'm really proud of the fact that a community organization across called the Hospice Organization for Halifax is working extremely hard to provide end-of-life care, Mr. Speaker, in a setting that I believe Nova Scotians are looking for, and one that we're proud to work with them, and hopefully we can find an operational agreement with them to make sure that we have that option, which means some palliative care beds will be removed out of the current site. Very proud of the fact, working with clinicians across this province and healthcare providers, today we were able to announce the vision around where we're going to go in the HI site. I'm really excited about the community outpatient clinic that will be outside of the centre core, Mr. Speaker. Very proud of the fact that healthcare providers, working with clinicians, identified there was space in West Hants Hospital to provide over 800 surgeries down there, Mr. Speaker. That's not sitting by, Mr. Speaker. That's maximizing our healthcare infrastructure that we have, and it's understanding, Mr. Speaker, what clinicians and healthcare providers have been looking for.
The Honourable Leader in the House for the New Democratic Party.
Yes, Mr. Speaker, the government's plan announced today calls for renovations and construction of existing facilities to begin in the short term. However, this work does not seem to be reflected in the budget. In fact, Mr. Speaker, the budget for hospital infrastructure has been cut by over $8 million this year. So my question for the Premier, why are planned renovations to existing facilities not reflected in the budget?
The Honourable Premier.
They are, Mr. Speaker. I want to thank the Honourable Member for the question. As you know, the Hospice Society will be building that piece of infrastructure, the entire capital cost. We're working on arrangement on an operational side. If she looks, some of our TCA was unallocated and worked towards the Windsor OR that we'll be able to make sure is up and running, Mr. Speaker. We've also budgeted for the design work on the 5th floor of the HI facility, the Halifax Infirmary. That That work is ongoing, as well as we budget for the design work of the community outpatients facility and the new work that's happening on the Halifax Infirmary site in terms of the expansion and development of that site. It would be inappropriate, Mr. Speaker, for our government to make any commitment until we actually get the true cost of what that was in, and I made a commitment to Nova Scotians that we'll do so. But in the process, Mr. Speaker, as we do the design work, we're going to work with clinicians and healthcare providers across this province to ensure not only do we build a new facility, Mr. Speaker, but we're going to provide an environment, Mr. Speaker, with their expertise that'll be there for the next 50 years, looking ahead, not looking back.
The Honourable Leader in the House for the New Democratic Party on her final supplementary.
Yes, Mr. Speaker, during today's announcement, the Premier left open the idea of using the P3 model for expanding post-operative facilities. The P3 model has been criticized by Auditor Generals from across the country. In the fall, our caucus tabled a briefing note from this government's own Deputy Minister of Health, which highlighted the many criticisms associated with the P3 model. So my question is to the Premier, given all the evidence against the P3 model, why is he still considering this approach for health facilities?
The Honourable Premier.
Mr. Speaker, anytime something new comes into the system, there's always people to criticize. Mr. Speaker, I'm not going to make a public policy decision that will be the next 50 years because I'm afraid someone might criticize me, Mr. Speaker. Fact of the matter is we're going to be looking at what is the best economic value for Nova Scotians to ensure that we get the health care system that they deserve, Mr. Speaker, and we're looking forward to working with our health care providers to make sure that when we go out to Nova Scotians to tell them the cost of this thing, that we've looked at every possibility of funding this health care facility, and P3 will be one of those options, Mr. Speaker, as well as we'll look at it as that Nova Scotians doing it. And we're looking forward to being engaged with Nova Scotians, Mr. Speaker, looking forward, solving a problem, and, Mr. Speaker, looking ahead like Nova Scotians always do.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. We know that buildings, the Victoria General site of the QE2, have been plagued with floods, Legionella, rodents, and countless issues for many years. Nova Scotians have eagerly waited for a plan to see the facility replaced and demolished. Today's announcement provided no information on contributions by the federal government or the province's share for that matter. The Premier capitalized on how much Nova Scotians want to see a new facility by making it a purely political stunt with no plan. When will the Premier disclose the facts and figures of this plan to Nova Scotians?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. I'm not sure where he was today, but it sounds like he was in La La Land, Mr. Speaker. But the fact of the matter is, we've made a commitment, Mr. Speaker. We budgeted for the design work on the 5th floor of the HI site. We've committed $132 million to the renovations in Dartmouth, Mr. Speaker. We made a commitment to the design work that's going to take place at the new facility and the community health facility, Mr. Speaker. We're looking forward to making sure that when we get to the design work, we put it out at RFP. When the cost comes in, we'll communicate that to Nova Scotians. But there's one thing, Mr. Speaker, the honourable member should remember. Well, he sat still as the Minister of Health. This Minister of Health is acting, and his Premier is going to support him.
The Honourable House Leader for the Official Opposition.
I laugh so much at that one, Mr. Speaker, is the fact that the minister wasn't even invited to the stage to talk today. So I don't know why he was being quieted down when he made this great announcement today, because maybe he knows there's actually no detail to be released to Nova Scotians on the replacement of the VG site. That's why. Further to the lack of detail we received this morning, there was no indication on whether or not this project would be private-public partnership, where each facility would be located, which procedures would be available. The government had once again made an announcement to make a plan, to do another plan, Mr. Speaker. Nova Scotians deserve better than what they were provided this morning on the replacement of the VG site. My question to the Premier is, why did the Premier not ensure a true plan was in place before making such an important announcement?
A question to the Speaker wouldn't be bad once in a while, you know. The Honourable Premier.
Thank you, Mr. Speaker. And I want to thank, Mr. Speaker, the healthcare providers who were there, Mr. Speaker. I want to thank members of the public service.
Order, please.
There,
the Honourable Premier has the floor.
I want to thank all of the members, Mr. Speaker, of the Health Authority, of TIR who were there, Mr. Speaker, in the briefing that laid out much of the detail the honourable member is talking about. The fact of the matter is, Mr. Speaker, it wasn't a political event. Why would we end up having more than one political figure standing up speaking to the issue? But I can tell you, Mr. Speaker.
Order, please. The Honourable Premier has the floor.
Mr. Speaker. Mr. Speaker. Mr. Speaker, and I'm sure if the honourable member follows the news, he'll have heard what the Minister of Health had to say, Mr. Speaker. That's usually where they get their information from.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. Many Nova Scotians are concerned to learn that the government made the decision this week to cut $3.1 million from Nova Scotia's nursing home facility-based care budget. This decision to reduce funding to nursing homes is concerning on many levels, but especially so given our aging population. So I'd like to ask the Premier, how can the Premier justify cutting $3.1 million from nursing homes given our province's demographics? The
Honourable Premier.
Mr. Speaker, working with our partners across this province, the honourable member is referring to 1% out of that budget. We believe that 1% can be achieved through the administrative costs, working collaboratively among a number of facilities, whether it is through procurement. A number of these homes are owned by the same operator. We believe this is an achievable number without affecting patient care.
The Honourable House Leader for the New Democratic Party.
So what about the thousands of seniors on the waiting list, Mr. Speaker? That 1% they're concerned with. Eliminating millions of dollars of funding to nursing homes means that resources will be stretched thin and making it more difficult for our long-term care healthcare workers to maintain the quality of care that is needed, Mr. Speaker. At the same time, the Premier cut $3.1 million in funding for nursing homes. He also cut $1.3 million from continuing care risk mitigations, the very people who make sure our seniors are being cared for adequately in nursing homes. So my question to the Premier, can he say that he's proud with his decision to cut the budget from our province's long-term care system?
The Honourable Premier.
Speaker, I want to thank the honourable member for the question. First of all, I want to assure the honourable member that health care providers and long-term care facilities across this province will continue to provide the top quality care that they've been providing, Mr. Speaker, and they'll do so with the support of this government, Mr. Speaker. I want to congratulate the Minister of Health for the work that he's been doing. We're at an all-time low when it comes to the wait list for long-term care facilities, Mr. Speaker. We're going to continue to work with service providers across this province to ensure that Nova Scotians receive the care where and when they want it, Mr. Speaker. That's why we've invested in home care for the third budget in a row. We're going to continue to work with our providers. And, Mr. Speaker, that 1% reduction we believe can come out of administration. We're prepared to work with our providers to make that happen.
The honourable member for Inverness.
Question for the Minister of Justice. Mr. Speaker, it was very sad to hear of the deaths of two young men in this city. Our thoughts are with their families and friends, and our thoughts and prayers are with them at this time. Mr. Speaker, this brings the total number of murders up to 6 in HRM since the start of the year. We know the police are doing all they can, investigating these matters and attempting to restore peace in the community. Has the Minister of Justice met with HRM police officials to ensure they have all the resources and tools that they need to have at this difficult time?
The Honourable Minister of Justice.
Thank you very much, Mr. Speaker. And the honourable member opposite raises a very important question, one that certainly troubles us as well, and I know is of great concern to the people of Nova Scotia. And again, I'd like to echo his sentiment about our concern for the families that have been impacted and the communities that are impacted by the loss of these young lives. Mr. Speaker, the HRP issued a statement yesterday, and it was a joint statement, RCMP and police, talking about their efforts, that they're working round the clock on the investigations, reassuring the public as well of the safety, and that is paramount concern, and that's certainly the way the Justice Ministry regards it as well. We are always in touch with them. I have not gotten involved in any of the investigations, but our public safety is always in touch with the RCMP.
The honourable member for Inverness.
Well, Mr. Speaker, and it is concerning in the budget, Mr. Speaker, that we're seeing a reduction in the Boots on the Street program. I know there are many causes of crime, but certainly this is a program that has helped, certainly correlated with a reduction in crime in the province. Mr. Speaker, the Minister was unable to say how many officers will be eliminated with that decision. Will the Minister tell us today how many police officers will be eliminated as a result of that budget decision?
The Honourable Minister of Justice.
Thank you very much, Mr. Speaker. And as I indicated before, we're about to do a review of the positions and where they can be most effective and how policing should be delivered. It's important to note, I did say the other day that the program is valued at $16.2 million. That's a substantial commitment, and it currently has, I think, 138 additional officers paid for by the province of Nova Scotia to help with the safety in our province against a backdrop of declining violent crime. It has gone down. And also the fact that when this was introduced, we were well below the national average on the number of police officers per capita. We are now above that. So I think that's important to note. And, Mr. Speaker, I'd like to just table a document that talks about the number of police we have in the province per capita, just so that all members of the House have access to that information as well. Thank you.
The honourable member for Sydney River, Myra, Lewisburg.
Well, thank you, Mr. Speaker. I would suggest the Minister of TIR put his earpiece in. Mr. Speaker, there has been significant confusion and concern in Nova Scotia about the enforcement of National Safety Code 11B for trucks and trailers. The trucking industry is concerned about the inspection process for brakes. It has not been made clear to them whether wheel-off inspections will be required in all classes, and if so, this would add a considerable amount of time and cost to the inspection. So my question to the Minister is this. Excuse me. My question for the Minister will be, will the Minister clarify when wheel-off inspections will be required and how his department intends to move ahead with the enforcement of this national standard?
The Honourable Minister of Transportation.
I missed that question, Mr. Speaker. With the member. Mr. Speaker, I thank the member for struggling through that question, and it is an important one. I met with a group led by Jerry Fulton, who probably brought the same issue to the member. The reality is that the member's description isn't that far off. It is a national standard. Our idea and the intent and what was provided to our motor vehicle inspectors and representatives here in Nova Scotia was that it would be applied to each and every province. The industry is hearing contrary, and they're saying that it's not being applied everywhere. So obviously, if it's not being applied to the full extent in our neighbour provinces in particular, that's an issue for us. So we have taken that. We're looking at talking with the other provinces to get the full scope, and we're not going to make any decisions until we know with certainty that it's being applied across the board. Thank you.
The honourable member for Sydney River, Myra, Lewisburg.
Thank you very much, Mr. Speaker, and I want to thank the Minister for that answer. The trucking industry wants to have it made clear what the limited inspections will be acceptable, or is it going to be wheel-off inspections? The standard applies to all commercial trucks, trailers and buses. We know that trucks at small rural fire departments are hardly commercial, don't travel great distances, and the added cost of enforcing the standard could add cost to these departments that they simply can't afford. So I will ask the Minister, will the Minister please clarify how this standard will be applied to fire trucks in the dozens of volunteer fire departments in our province?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. And again, it ultimately goes back to the regulation, obviously, as we've discussed with the association, with the organization that came to meet me directly here in the city, is that we've got to know that safety trumps and paramounts every other aspect, and obviously no trucker, no organization, no private sector operator wants to put themselves or their staff in jeopardy and at risk. There's no doubt about that. So we've got to determine if this is a pure safety aspect of this inspection. It is additional time. It's certainly additional cost to have these vehicles have their wheels pulled completely off the axle. So we are doing that investigation, Mr. Speaker. We do understand the impact. The group made a very compelling case, but we have to know that our fellow provinces across the board are applying this, and if that's the case, we'll look at clarifying that information. But we are holding steady now, and we're going to get more information back to the group. Thank you very much.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. My question through you will be to the Minister of Health. During the 2013 campaign, the Liberals promised every Nova Scotian would have a family doctor. When asked in October 2014, actually the member for Sydney River, Myra Lewisburg, could use a doctor right now. When asked in 2014 about the status of this promise, the minister said that 94% of Nova Scotians had a family doctor. This minister, I think, overlooked the more than 56,000 Nova Scotians who do not have access to a family doctor. This week, Doctors Nova Scotia highlighted its disappointment in the fact that there was no investment for family physicians in this budget. So my question to the minister is, how does the minister expect his government to fulfill their campaign promise if no investments are being made for more family physicians?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I would preface my answer to the member opposite by saying today we had the most significant hospital announcement in a couple of decades, and it's an announcement for it's an announcement for Atlantic Canada, and rightly so. The Premier should be making that stellar announcement.
The Honourable House Leader for the official opposition.
No, he already answered. I'm sorry. Well, if he goes for the laugh track, I mean, there you go. Thank you much, because you didn't really answer the question there. So not only do tens of thousands of Nova Scotians not have access to a family physician, but collaborative emergency centres are being forced to close, as we hear from the member for Shelburne tell us every time during member statements. These centres were designed to help those living in areas with frequent emergency room closures and a few family doctors. Nova Scotians are now seeing this government does not see their campaign promise as being a priority. Does the minister plan to fulfil his government's promise to provide a family doctor for every Nova Scotian, as they promised in their election platform?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. As the member opposite knows, there will always be challenges to get physicians to every part of the province where we need doctors. We also have about 3% of the population that do not ask for a primary care provider. In this budget, there is $6 million additional dollars for physicians. I'm pleased to say that there will be 40 new physicians starting in Metro, 10 new physicians in Cape Breton, and due to the residency program that we've supported in Yarmouth, Shelburne will get a new doctor come July.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. My question is for the Minister responsible for Part 1 of the Gaming Control Act. Yesterday, the minister was so busy coming up with insults about a situation he actually knows nothing about and practicing his best Donald Trump-style bullying that he forgot to answer the question I asked. So again, how many fewer
please. Inferring that other members are bullying is unparliamentary. I'll ask you to retract that.
Mr. Speaker, how many fewer VLTs will there be in Nova Scotia by the end of this fiscal year?
The Honourable Minister responsible for the Gaming Act.
Speaker, we're very fortunate in Nova Scotia to have a regulated gaming system that practices responsibility and ensuring that people are gaming in a safe way, while at the same time that the revenues that come from that are there to benefit all Nova Scotians. We'll certainly continue to ensure that our gaming industry runs very smoothly in our province.
The Honourable Member for Dartmouth East.
Mr. Speaker, he still didn't answer the question, which is how many VLTs will there be in the end? And he knows that there was an attrition policy and they were being taken out in each of the previous years. Those numbers should be readily available, quite frankly. Mr. Speaker, yesterday I noticed that in many jurisdictions VLT play is declining, and I will table some additional information on that today. And often it's to things like online gaming. In 2010, the only province in Canada, for example, to see an increase was Saskatchewan, and that trend has continued. Mr. Speaker, the minister said yesterday that they have replaced the games on terminals with more attractive products. So, Mr. Speaker, based on that statement, does this mean the government is actively working to increase VLT revenue?
The Honourable Minister responsible for the Gaming Act.
Mr. Speaker, we're very proud of the gaming system that we have in the province, the cooperation that we have. We're one of the only provinces in the Atlantic region that has its own provincial gaming authority that works directly with Atlantic Lotto, that is continually reviewing what is available for gaming and again ensuring that there is responsible gaming taking place. Many of the terminals, all of the terminals now have safety features that are put on them to ensure that players are gaming responsibly, and we'll certainly continue to work closely with our partners to have a safe, regulated gaming industry in Nova Scotia.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. The government has no immediate plans to address the dilemma faced by many Nova Scotians who cannot find a family physician. The Nova Scotia Health Authority provides a toll-free number for patients to call, and the minister has responded to my question and letter with that same number, Mr. Speaker. But I'd like to table an email sent out from the Health Authority to physicians that state due to the number of family physicians, patients who call the number may have to wait up to 6 months for their call to be returned. Mr. Speaker, my question to the minister is, why would it take up to 6 months for the Department or Health Authority to simply return a call to patients in need of a family physician in Nova Scotia?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And if it's referring to recruitment for a particular location and practice, maybe it was a case of wanting to get up-to-date information. Nevertheless, I will check out why that delay is taking place. I think the member opposite does ask an important question when patients need to know information immediately.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, in 2013, the Premier promised to ensure a doctor for every Nova Scotian, and I'll table that, Mr. Speaker. However, instead of attracting doctors, this government seems to be more interested in creating headaches for doctors we have now. I'm hearing from physicians across the province who are upset with the new erroneous credentialing process being instituted by the Mega Health Board, Mr. Speaker. Physicians are already required to go through credentialing process with the College of Physicians here in Nova Scotia. So my question to the minister, does he not trust the College of Physicians to provide accurate credentials for doctors practicing here in Nova Scotia?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Obviously, we have the greatest, support for the college and the decisions they make. In terms of the NSHA, what they are actually doing is reviewing the full possible scope of practice and areas where they can go. Some of that is required in terms of management process. There was also some conflicting information that did come across CBC this week, and I think the department has moved to make sure that all doctors are aware of the process.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, my questions to the Minister of Labour and Advanced Education. Both Ontario and New Brunswick have announced plans to cover tuition for students from lower-income households. Nova Scotia universities rely on students from other provinces to fill our seats, with only 48% of our students being from this province. My question to the Minister is, when will the government know the impact of these changes in other provinces will have on the enrolment of Nova Scotia's universities?
The Honourable Minister of Labour.
I want to thank the honourable member for the question. We don't have all the details from the various plans from the other provinces. It does appear that New Brunswick's is tied to students staying in that province. Ontario's, last time we had a conversation with them, did not appear to be that way. They're in the middle of revamping, so we don't have any information on that. What I can tell you is I've spoken to a number of university presidents, and they're telling me that their expected enrollment is up because they've had more inquiries and more conversations with students in other provinces. I can tell you other provinces, Mr. Speaker, would be happy to have the percentage of out-of-province students that Nova Scotia has. We're the envy of the rest of Canada.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker, and thank you to the Minister for that answer. Mr. Speaker, there are fixed costs associated with these universities, and declining enrollment due to being uncompetitive will increase the cost for all taxpayers. We can't risk losing these students to other provinces. So my question to the Minister is, what plan does the government have to address losing enrollment to other provinces due to uncompetitive tuition rates?
The Honourable Minister of Labour and Advanced Education.
I want to thank the honourable member. There's no indication at this point that we are in fact losing any students, Mr. Speaker. And I would remind the honourable member that the student assistance programs actually follow the students from their originating home into other provinces. So until we have a handle on what is happening with other provinces. We really can't make any plans for an enrollment disruption. I will say, Mr. Speaker, that I indicated yesterday that I have met with the Saudi Arabian Cultural Bureau, and we have indications that they have restored the King Abdullah Scholarship eligibility for one of our universities, and we look forward to seeing more students come as well. Thank you.
The honourable member for Pictou Centre.
Mr. Speaker, my question is for the Minister of Communities, Culture and Heritage. Mr. Speaker, public libraries have not seen a real increase in their core provincial-based grant in 6 years. Now it appears we are looking at a 7th year of frozen provincial funding. During the 2013 provincial election, the current government assured the Pictou Antigonish Regional Library Board that they would work with all library boards to create a sustainable future. My question to the Minister: why did this government break their promise to help Nova Scotia regional libraries?
The Honourable Minister of Communities, Culture and Heritage.
Thank you, Mr. Speaker. Mr. Speaker, I'd like to thank the honourable member for his question. This government puts $14.4 million into libraries. Libraries are vital and really important to our communities. So we do continue to work with the libraries. The library board itself came to us and asked us to do a review. We are working on that review with them currently.
The honourable member for Pictou Centre.
Mr. Speaker, more detail will be exposed during estimates, but Tuesday's budget showed a net position of $71.1 million. However, there appeared to be a $1.5 million cut to archives, libraries and museums. Regional libraries are faced to make tough decisions, perhaps closing up to 1 day per week, shorter hours, and cutting staff. In fact, many part-time staff may lose their benefits. The answer is for government to make a small investment. Even $500,000 over 3 years would keep libraries afloat. My question to the Minister: will the Minister commit today to providing Nova Scotia regional libraries a reasonable sum so they can continue their core services and contribute to overall community development and well-being?
The Honourable Minister of Communities, Culture and Heritage.
Mr. Speaker, the $14.4 million that I spoke about is just a contribution. The library boards do get funding from municipalities, from the library boards and private partners. That being said, as I said, there has been a review. There was a review committee struck with municipalities, with the library boards, with members from Culture and Heritage, with members from the municipal affairs, and members from the boards themselves. They sat down, they spoke with us, they shared with us their points of view about this review. We are looking at it. We will reach out to those members and those stakeholders shortly, and we will continue to work with them to try to come up with a solution.
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Health. Mr. Speaker, in a press release entitled Government Investing in Health Facilities from the Department of Health and Wellness dated December 23, 2013, it stated this: patients in Halifax, Kentville, Bridgewater and Dartmouth will have better access to dialysis treatment with a $5 million investment in the 2014-15 to expand services. Mr. Speaker, my question to you for the Minister of Health and Wellness is this: when will the residents of the Valley see this improved dialysis service in Kentville?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. As the member opposite knows, this is a provincial program, the provincial renal program, and they really trigger when they are completely ready, with design and all of the requirements that go into dialysis. And we had a meeting recently, the Premier and I, and we asked for a few questions that needed to be answered, and that's in process now.
The honourable member for Kings North.
Mr. Speaker, I have a friend on dialysis. His name is Peter, and he has to go 3 days a week to Halifax. It's a 4 to 6 hour time in the renal unit plus travel, and he can't drive himself. He needs to have a driver. When he realized the daunting difficulty of achieving this in his life, and he asked someone, and I don't know who it was in the Department of Health and Wellness, what he should do. He was told quite bluntly, move to Halifax. That was the solution. While we talk about this for a couple of years, my question for the Minister is this what the Minister would advise people in the Valley, like my friend Peter, in the difficulty of the realities of dialysis?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I'm very familiar with this program, and I look at some of the advances that have been made across Nova Scotia in developing a provincial lens to meet as many regional and geographic areas as possible. It is truly a hardship when patients have to travel extreme distances and time, along with the lengthy period of 4 or 5 hours of dialysis, and we are moving as quickly as possible to get dialysis across Nova Scotia.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Mr. Speaker, it doesn't take much to have the highest per capita spending in a small province like Nova Scotia, where population is less than 1 million people. But the experience of women's centres in this province does not back up the community services' recent rosy claims. The reality is that women's centres across the province are struggling to meet increasingly complex needs in their communities. They're expected to hire and retain staff and offer essential programming with inadequate and unstable funding. So my question, Mr. Speaker, can the Minister please tell us if she finds the level of funding for women's centres in this budget to be acceptable?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker, and I thank the member for the question. When we came into government in 2013, part of our campaign commitment was $500,000 increase to transition houses, women's centres, and for the first time ever, I might add, second stage housing for women and children. When the funding decisions were made on that, what that resulted was an increase in funding to all nine women's centres across the province of $15,200, essentially bringing their funding up to $217,000. They do great work. They do a lot of project work. They get different grants from private and public partners. And so, yes, I am happy with the service level agreements that will go forth in the coming months and with the funding levels that are currently available in the province.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker, and I also agree. I think that's wonderful that they did the work that they did when they came in office, but I think we also have to give credit where it's due because, for instance, the previous NDP government also gave women's centres $500,000, which was their first raise in 20 years, and we actually introduced the sexual violence strategy, so I'm very happy to hear that the government's continuing on with that. So this budget, however, does continue to hold the line on funding for women's centres. So although the government seems quite happy to pat themselves on the back about this, there's little in the budget that will actually advance the status of women in Nova Scotia. So could the Minister please explain exactly how this budget does address the issues affecting the lives of Nova Scotian women?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker, and I'd like to correct the member. This government did the sexual violence strategy with a 3-year, $6 million commitment to every corner of this province, and don't ever mistake what we have done over the last 2 years of being started in the previous government. One of the things that I did as minister, one of the first things I did as minister was that I actually took all of the women-serving organizations out of the Department of Community Services and put them under the status of women where they belong, so that every time government met with every organization that serves women, it was done so with a feminist lens, because for too long, women's organizations in this province were lost in the magnitude of bureaucracy of the Department of Community Services. I'm proud of this budget. I'm proud of this government. We have worked with women across this province, and to say anything otherwise is not true.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. Last summer, the Department of Health pressed pause on the number of doctors who are able to use the electronic medical records in provincial hospitals. I have the CBC News article that I can table as well. At the time, doctors in Nova Scotia feared this break would deter doctors from using the systems in the future. In this year's budget, they expressed their dismay that there was no investment in a single province-wide electronic medical record system. With no investment in a province-wide system, is the minister concerned that a further delay will even deter more health professionals from using electronic medical records?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. We know that there are doctors who join on and use medical records, every day. The incentive plan that was there was to get that huge number of doctors in the system very, very quickly. Many offices now that doctors are going to will have certainly some electronic medical records.
The Honourable House Leader for the Official Opposition.
From the article, you can see that by pressing pause, no new doctors are able to get on the system, or no existing clinics are able to transfer their information into the electronic system. You know, Mr. Speaker, the ability to see a patient's full medical history and record can go a very long way in preventing mistakes and more precise diagnoses. This is the many ways we can protect Nova Scotians and healthcare workers from being misinformed and encourage better health, better patient care. After years of waiting, when can physicians and healthcare professionals finally see a province-wide system that is compatible in all hospitals and clinics?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And a member opposite former Health Minister asked a very, very important and relevant question. This was an area that we did put on hold for a year. We wanted to explore what was available in the marketplace. We will, in fact, during this fiscal year, we will be venturing forward to advance the OPOR, and I know there are many clinicians across the province that look forward to that day. We will also have a number of doctors who will work through the remaining years of their practice without electronic medical records, but the goal is to eventually reach 100% of our doctors using the electronic medical records, and to finally in this province have not 3 systems but 1 system for doctors.
The Honourable Member for Pictou West.
Thank you, Mr. Speaker. My question through you is to the Minister of Communities, Culture and Heritage. 3 years ago, the government announced that it would be creating a comprehensive cultural strategy to establish a vision and direction for supporting culture, and I'll table that. After consultations, the final report was expected to be completed in March. Will the Minister be tabling this report in the Legislature in this sitting?
The Honourable Minister of Communities, Culture and Heritage.
Sorry. Thank you. Yeah. Sorry, Mr. Speaker, I was interrupted. If I may ask the member to repeat that, please, for me.
Can the member repeat the question? The Honourable Member for Pictou West.
Thank you, Mr. Speaker. 3 years ago, the government announced that it would be creating a comprehensive cultural strategy to establish a vision and direction for supporting culture. After consultations, the final report was expected to be completed in March. Will the minister be tabling the report this sitting?
The Honourable Minister of Communities, Culture and Heritage.
Great, thank you. Thank you for that question. Our government really values a strong culture. And that strong cultural sector is very important to our economic growth in this province. That being said, we have heard from many people in the cultural sector, and we are still reviewing that report, and I expect that sometime early spring you should get some information on that report.
The Honourable Member for Pictou West.
Which year? Thank you, Mr. Speaker. We know that the department has recruited companies to lead consultations on the Cultural Action Plan. Nova Scotians want their government to find better ways to support and celebrate our vibrant and diverse culture. Will the minister please tell the House the cost of the consultants and when actually he expects to deliver the report?
The Honourable Minister of Communities, Culture and Heritage.
Thank you for the question. As I said, we will table the report and we will provide you the information once it is completed. Thank you.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, Dalhousie University's Board of Governors voted on Tuesday to raise tuition fees for all students effective September 2016. When mandatory additional fees are factored in, the annual cost for Canadian students to attend even the least expensive undergraduate program at Dalhousie will exceed $8,000, and the cost for other programs very close to $15,000. Well, it's no wonder that 200 students are using the university's food banks every month. Is the minister satisfied with this situation, and does she find that this to be an acceptable situation?
The Honourable Minister of Labour.
Thank you much, Mr. Speaker, and I thank the honourable member for the question. Yesterday, the honourable member referenced a slap in the face, and far from being a slap in the face, Mr. Speaker, our student assistance program is 100 million reasons why it's important for young people to attend school. Because $100 million, Mr. Speaker, is what the taxpayers of Nova Scotia spend each year to assist young people to go to school. $65 million of that, Mr. Speaker, more than $65 million of that is invested every year to make sure that post-secondary students graduate with reduced debt.
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now move on to government business. The Honourable Government House Leader.
Speaker, I would move that you do now leave the chair and that the House resolve itself into a committee on estimates.
The Honourable Leader of the Official Opposition.
Mr. Speaker, I'm looking to speak going into supply. Is that now? Okay. Thank you, Mr. Speaker, for that opportunity. It is my privilege to speak going into supply today. Mr. Speaker, it seems like a very good day to do this, actually, since we have the VG non-announcement, really, the re-announcement of things that have been in place for years. Mr. Speaker, with no money attached, the one big question that all Nova Scotians have about the new plan for the VG is how much is it going to cost? How are we going to pay for it? Mr. Speaker, clearly one of the main elements of a plan as big as this in particular is how are you going to pay for it?